Welcome to another episode of Progress, Potential, and Possibilities, discussions with fascinating people designing a better tomorrow for all of us. I'm your host, Ira Pastor.
Welcome, everybody, again to another episode of our show. Today, bringing you another really fascinating guest involved in creating a better tomorrow on some really unique fronts. Today, we have the honor of being joined by Irina Pelphrey, who is the Vice President of Health and Managed Care at Albertsons Companies, which is a major national grocer here in the United States. It's the second largest supermarket chain in North America, represented by many popular brands, including Albertsons, Acme, Vons. They operate somewhere around 2,300 stores, including 1,700 pharmacies in 34 states, including District of Columbia. And in her current role, Irina is responsible for leading their Sincerely Health offering, which is Albertsons' really unique health and wellness engagement platform. And she also is involved in overseeing various aspects of healthcare payer relationships across their pharmacy and their really unique new food as medicine program. Irina's career has been centered on its really important passion for healthcare, retail, solving these really unique customer problems, and delivering financial results for the company she works for. And she's really passionate about the use of analytics, about the use of data science for helping customers make correct decisions for the role of food, medication, behavioral change, ultimately how all of these things can play an important role in prevention and treatment of chronic disease. Prior to Albertsons, Irina held a variety of leadership roles at Walmart in their health and wellness division. She holds a bachelor's degree from American Public University and an MBA from the Kellogg Business School at Northwestern. We're honored to have her with us. A lot of interesting themes to get into today, but Irina Pelphrey, thank you so much for taking the time to come on the show today for a little while.
Thanks, Ira. Great to be here, and wonderful to start this conversation.
Yeah. No, I've really been looking forward to this. As we typically do, I would really like to start off by handing things over to you just to further introduce yourself a little bit, because as I mentioned in your bio, you've been sort of since the beginning working at this really interesting intersection of health, retail, and then of course sort of digitalization. Take us back a little bit to the beginning and tell us your background story, if you would.
Yeah, absolutely. I've been really privileged to be part of what I would say transformation in healthcare. There's a lot of conversation about retail healthcare, but not many people are privy to what the evolution has been. I kind of got introduced to it as a non-clinician in a unique way, starting with the evolution of retail clinics. Back at Walmart, at that time, a lot of retailers were dabbling in, building their own clinics, collaborating with health systems. At that time, that was kind of one of the two modalities that existed, is urgent care modality or convenience care, and collaboration with health systems. So that's kind of how I got introduced to even bringing healthcare into a retail setting, beyond pharmacy and optometry, and that was at Walmart. It's a really interesting space for a couple of reasons. One of the reasons is access, right? Retailers bring an unparalleled access that just can't be delivered by traditional players. then the second piece, I worked with many pharmacists and have just a huge respect for the profession. And one of the reasons is because customers truly trust pharmacists.
Right.
Frequently it's really the first line of advice and first line of recommendation, because community pharmacists are so accessible. I think if I recall the statistics, currently in the US, we have about 55,000 pharmacies. That's in line with the number of fast food restaurants. So from accessibility perspective, that's a really great part of our healthcare ecosystem and a really valuable clinician. So and it's been interesting to kind of see how pharmacy stepped into the forefront. First was just basic immunizations, flu, but then pharmacy saved the world, in my opinion, by really impacting the trajectory of the COVID pandemic. And I'm really proud of my company's contributions to that. Our output per door for COVID immunizations during the pandemic was just through the roof. It was, higher than many of our competitors. And we're really proud of that contribution, because I think it made a difference in the lives of our customers, preventing, spread of disease and putting I feel like our pharmacists made a contribution to putting an end to the pandemic in a way. Mm-hmm. So that's been really, really a fun ride, just seeing how pharmacy flourished in this space of preventive care, and also just in the space of day-to-day care. And that's really what brings me to some of the work that we do today, is really using this frequency that retail pharmacies, community pharmacies have, that trust, and also adding an element of nutrition and support, and in the sense of kind of daily living that Sincerely Health brings. Mm-hmm. Mm-hmm. And I think the main observation is, as I look at traditional healthcare delivery settings, of course, primary care is immensely important. But if you look at the statistics of that frequency, right, I think an average patient sees their provider 2.8 times a year. And the duration of that encounter is 80 minutes in total. Yeah. So, what happens in between? Who is helping patients with their kind of daily decisions that make actually all the difference? The impact of lifestyle is really big on progression of chronic disease, on prevention of chronic disease. So that's a lot of what we think about at Albertsons, is how to help customers in those daily decisions and those weekly, monthly decisions as they visit their grocery store, as they visit their pharmacist. So yeah, and that's really what much of my passion revolves around, is how to unleash the community access. And now it shows up in digital ways, right? Healthcare accessible that way. So that's what's been really getting me excited, getting me up in the morning every day.
Well, that's awesome. And I'm sitting here smiling because I was trained as a pharmacist and did practice community pharmacy back in the day. And as you were saying, I dispensed pills back then, right? I put pills from big bottles into little ones, and it's much different nowadays. And I can go, into an Albertsons, and I could spend the whole day there now, just taking care of my health. And as you so appropriately point out, the fact, if we want to get into prevention and we want to get into wellness, it's going to be more than just a couple of visits a year. That being said, take us a little into the theme of food as medicine, because this is something, obviously, we have the Hippocrates quote from thousands of years ago: "Let food be thy medicine, let medicine be thy food." Clearly, that's evolved quite a bit. Everything from, okay, we know we would need food for calories, and then we needed food for nutrition. And now, as we get into the current day, we know so much more, whether we're talking about the intricacies of interesting phytochemicals that are in the foods we eat. This whole area of nutrigenomics that, is potentially capable of saying, hey, I eat spinach, it's good for my blood pressure. You eat carrots, it's good for your diabetes, whatever. Walk us through a little bit of how you look at food as medicine and why, and maybe it's kind of obvious, but why Albertsons decided this was of an important area to sort of continue this healthcare evolution in.
Yeah. So I think, staying aside from any, gimmicky article that you might read about the superfood and that, the foundation should be an evidence-based studies on nutrition, right? One recent one that I just read that came out in Nature is that whole grain and fruit and vegetable based diet, when applied consistently, can increase lifespan by 10 years. People aged between 40 and 50 years if they continue that. The same when applied in the 70s can expand the lifespan by 5 years. So there are hundreds of studies that prove the importance of healthy diets such as Mediterranean diet and their impact on disease reversal and disease prevention and just quality of life, right? So we know there's a clear connection between food, its impact on chronic disease, and its ability to actually improve outcomes. So inherently, we believe that proper nutrition should be part of any care plan. And in the current state of affairs, nutrition is given very little attention in kind of medical curriculums, even pharmacy training for that matter also. So dietitians, of course, are hugely important, but how many dietitians are engaging with customers on a daily basis, or even, with the same frequencies that physicians do? So the linkage and the proof points are there from a science-based perspective, but I think what's missing is the everyday tools and translation. Okay, so people generally know that they need to eat more fruits, vegetables, whole grains, etc., but most of them don't do it. In fact, some of the work published by USDA relative to My Plate, which is the national guidelines for Americans on how to eat, demonstrate that most Americans underconsume fruits and vegetables, underconsume whole grains, overconsume simple carbs, and overconsume proteins. We're actually seeing very similar trends in our own data. So we feel that there's an imperative to do something about it, given the epidemic of obesity this country is facing, given the rampant growth of chronic disease, diabetes, cardiometabolic syndrome. There are other costly things that impact our health system, cancers, MSK, etc. But this is something that's within our control. We can choose what to eat, and frequently it can improve medication regimens that customers are already on, and just make their every day a little bit better. And there's another component to food. Food has a linkage to our psychological well-being too. If you think about, when we celebrate, food is involved. When we're sad, there's some sort of element of maybe junk food, which is okay. Sometimes it's part of life, as long as we don't make it everyday part of life. So I think for us, food is just an integral part of what we offer to the customers, our value proposition. In fact, our mission is centered on gathering people around the joys of food and inspiring well-being. So with kind of our work in food as medicine, we're trying to satisfy both. Food has meaning as part of our daily activities, part of community, but it also has a huge role in inspiring well-being. And that's kind of what inspires us to do the work that we do in this space.
Excellent. And so, moving into that a little deeper, and you, as mentioned in the bio, you wear the role of vice president of health, in addition to the work you do in managed care, specifically focused on this area. And there's really two core components to it. I see one, that you have to have data-driven, non-gimmicky, unbiased solutions from to prove that this food is our medicine, and then the technology, which we'll get into a little bit. Talk a little bit about the initiatives. I know that you are one of the founding members of the Food Med Certified program, which is part of this Validation Institute. What's that all about? And ultimately, how do you go about you really making these outcome-driven programs reality?
Yeah, so our participation in Food Med Certified is just really a confirmation of our commitment to evidence-based approaches in nutrition supports and in food as medicine. So Food Med Certified is part of Validation Institute, which provides validation from an evidence-based perspective to any healthcare interventions that employers or health plans may care about. So as we think about the evolution of food as treatment or food as medicine, we recognize that payers will need to play an important role. Just like there's a benefit for medications, we believe that there's going to be a need for a more structured benefit for medically supportive foods. And I'm talking beyond medically tailored meals, which are currently available to a fairly narrow subset of the population. So and we also think for health plans to really embrace this type of benefit and really think about covering food as part of their overall package, it's really important to have evidence-based outcomes for different types of interventions. And they could be behavioral interventions that establish patterns of healthy eating without actually covering the food, or it could be grocery bundles that aim to address specific disease outcomes. Could be kidney disease or diabetes treatment. So that's just to reinforce our orientation and our grounding and science-based outcomes. As far as kind of thinking about data-driven decisions and anchoring on frameworks, I already mentioned My Plate, published by USDA, which is a body of work funded by our government and rooted in nutrition science. So that's really what we lean on in developing our own technology, and that's the core data set that we use to evaluate products, to rank products, and really to provide recommendations to customers on what a balanced basket looks like. So, specifically, one of our most recent features in nutrition is helping customers align their basket to My Plate. So regardless of the size of their household, we can look at their past purchases with their permission, of course, and tell them if they're missing any key food types. So, typically I just don't get enough fruit. So that's something that I didn't realize, but became apparent to me as I started looking at my own shopping habits for my household. And within that, a lot of people struggle with whole grains. A lot of people struggle with under consuming fruits and vegetables. So that's something that's, once you have the information, you can correct it, you can improve it. And overall, a balanced diet in the long run, again, leads to improvement of many health markers and also longevity in the long run.
And let's have a little more into the platform of Sincerely Health, because I went in and I checked it out, and it's really quite comprehensive in the sense it's yes, you're advising hey, more fruits and vegetables here, whole grains here, but it's really much more than that in terms that get into things like sleep hygiene, the amount of physical activity, and then I saw one of the press releases about you were talking about digitalization combined with customization, is core to this. So that, I just like we're in the era of personalized precision medicine. Personalized precision nutrition is just, it's here. And clearly, this app is an example of what can actually be. Talk a little bit more about Sincerely Healthy, if you would, and a little bit about I know there's this Dakadu platform that you're partnered with to make it all reality, but say a few words about that too, if you would.
Yeah, absolutely. Well, if I step back, I talked about huge importance of nutrition, importance of medication adherence and treatment regimens. But if I step back, health is a multifaceted concept, right? It's not just about what you eat. It's not about the medications that you take, but it's just the sum of daily actions, starting with good sleep, having added healthful activity throughout your day, psychological balance. So all these things impact your overall well-being, and that's really what's behind Sincerely Health. We want to be our customers' partner in their well-being journey. We recognize not everyone has the same journey. My activity may not look the same as yours. You might be a marathon runner, and my goal is to get 10,000 steps a day. So we want to be able to provide solutions to customers that help them establish good goals, when it relates to activity, nutrition, good habits, helps them sustain those habits and rewards them for those habits, because everyone likes positive reinforcement, and people are motivated inherently to just improve over time. So Sincerely Health addresses all of the areas of whole health, really, in some respect. Addresses sleep, addresses activity, addresses nutrition, medication adherence. So we provide reinforcement to customers through coupons for some really important actions, and through daily healthy points, which is a reward system of its own, that encourages them to persist. If I took up a goal, let's say I want to eat more fruit because I'm deficient in fruit, I can take a goal of adding fruit as a dessert to every meal. And I can take that goal for a week, get awarded some points. If I like that goal, I can stick with it for another 21 days. Well, guess what happens after 21 days? Typically, habit formation happens after 3 weeks. So we're leaning into some of the behavior change and behavioral science behind what it takes to change a lifestyle. And what it takes is really those small changes that are rewarded on a consistent basis. Intrinsic motivation or extrinsic. In this case, we provide a little bit of support for our customers that way.
Awesome. What the other thing that was quite interesting. I know that you, Irina, represented Albertsons last year at the White House conference on hunger, nutrition, and health. Again, and not just talking about obviously the use of science, of these technologies to improve nutrition and health, but also, we have a major hunger problem in this country. And again, coming back to this issue of access and being, such a large company in so many neighborhoods and so forth. Talk about your journey to the White House, what you told the president to do, what was going on at that meeting. I'd love to hear about. It sounds like a really cool initiative.
It was a really exciting event, and really a marquee event, given that this conference hasn't happened in a really long time. I think the last time it was in the 60s. So it was really encouraging to see a lot of different stakeholders, of course, including the government, coming together to talk about the problem and to think about solutions to the problem. So I think there are two dimensions to kind of how the conversation evolved, right? So one is the foundational, that nutrition really plays a role in well-being. Starting with food insecurity, obviously you can't be well if you don't know where your next meal is coming. all the way to nutrition security, really thinking about what people are eating and what's the nutrition composition of what they're eating. And the conference gave voice to a lot of different stakeholders, from those people coming with lived experience. What's it like to be food insecure? What's it like to be on SNAP and WIC benefits, and what does that experience look like? All the way to at-risk stakeholders. It might be your Medicaids, your Medicare plans that are thinking about the future of how food and lack of food is impacting their populations that they're accountable for. Obviously, as a grocer, we play an important role in providing access. I think where I got really interested is thinking about bringing stakeholders to create holistic solutions. In some cases, funding may exist to close the gaps, but customers don't know about it. So bringing many disparate systems that connect USDA funding, CMS funding, and bring it all into one kind of easily consumable funnel so that customers can benefit from it. and we believe that connectivity can happen through retailers and in a retail healthcare setting, in a grocery store or in a pharmacy. So, and a range of solutions that was discussed was not related just to nutrition. It was also about physical activity, which we have also a keen interest and we think is really important, because we've invested in physical activity and sleep as some of the core components supporting Sincerely Health. And we do think we can make a difference even in that area. And if every stakeholder just does just a little bit, I think we can make a difference in the country overall.
Absolutely. Talking about that for a moment, I'm here in downtown Philadelphia, and down the street here at Children's Hospital of Philadelphia, they recently created what's called a food pharmacy, where they have these produce prescriptions that can be written for patients to access certain types of foods they might not have available in their neighborhoods. It might be a food desert or what have you. You mentioned things like medically tailored meals and groceries. Talk a little bit about sort of what else excites you in this space that maybe Albertsons not involved in it yet, but you see these trends. And at the same time, if you could just say a couple words about, when we hear things like produce prescriptions or medical foods, what's the reimbursement situation for stuff like this? What do insurers and the big payers have to say about this area nowadays?
It's a really complex space from a reimbursement perspective. One trend I'm really encouraged by is the way individual states are approaching the problem. So there is a movement across Medicaid programs to really, put waivers in place to test programs related to nutrition and food security. I would say, one great example is California, that allocated a lot of funding to a variety of SDOH related initiatives, food being one of them.
Right.
So I think it will take initiatives like that, where experimentation happens and outcomes are measured, for all of the at-risk payers to get on board. Another kind of promising area is Medicare Advantage. As you may know, coverage of over-the-counter medications has been around for many years, and it was a differentiating factor in how health plans competed back in the day.
Yeah.
Not so long ago, food benefits were added, and a lot of plans are opting into covering fresh food, fresh produce in some cases, or just healthy food at large, with larger allowances for dually covered populations, so those on Medicare and Medicaid.
Okay.
So those are all really promising and very encouraging, because some payers are really jumping on the bandwagon. I don't see as much activity in the commercial space. What activity does happen is more related to kind of wellness and engagement, and there are provisions there, but there isn't a pattern that I would say you can apply across the board to all payers and see consistently executed. So I think that's part of where we have an opportunity to create a framework for what I would say food care plans or food benefits. And I think it's going to be really, really important for the health of the country really to figure it out.
We're approaching 2024. Irene, I know that you have gotten out sort of on the conference circuit a lot in 2023, talking about food as medicine, talking about creating this culture of health. What's coming up? What should we know about for 2024? Any upcoming initiatives that you can tell us about, or anything about your schedule in the coming months in terms of conferences, talks you're going to be giving, any place we can run into you, listen to you, meet you, anything else that I missed, please?
Yeah, I would say in terms of focus areas, as a business, we're really doubling down on bringing more comprehensive nutrition solutions, both digitally and in store. We're definitely going to continue to talk about that, and now we'll have some impressive results under our belt that we'll be able to share next year. In terms of kind of interest and conferences, I expect that we'll definitely participate in a lot of grocery forums and a lot of payer forums, specifically working with stakeholders in Medicare, Medicaid, and USDA, kind of thinking about a broad spectrum of stakeholders and interacting with them. Really leaning in on food as medicine and participating in those forums, because I believe it's always important to have a grocer voice and a pharmacy voice as well. Yeah. I expect to participate in some of National Association of Chain Drugstore initiatives as well, related to prevention and really elevating food as medicine as one of the services that could be available in pharmacies down the road, and just really focusing on prevention, and again bringing the focus back to accessibility of pharmacists and their availability to do preventive screenings, to do point of care testing, of course, immunizations and the like.
Yeah, I think, once again, hammering that point about accessibility, and as we get further into the wellness and prevention area, that this, as you were saying earlier on, this is more than just visiting your doctor a couple times a year. This is a proactive system, and seeing programs like this is just so refreshing. And I'm going to look forward to continuing to follow you and the entire set of initiatives that you've championed. It's just really very impressive. Again, for everybody that's going to be listening to this particular episode of our show across the various podcast networks, or watching on our YouTube channel, again, you've been listening to Irina Pelphrey, Vice President of Health and Managed Care at Albertsons, doing really amazing things in terms of using this healthy food as medicine model to intervene when chronic degenerative diseases, create this healthy culture, this culture of health. Irina, I really want to thank you for taking the time today to come talk to us for a little while and tell us what you're up to. Obviously, thank you for what you do. And as we like to say here on our show, thank you for helping to create a better tomorrow via what you do and creating these types of programs. It's extremely impressive.
Thanks so much, Ira, and thanks for really paying attention to what's going on in the space and asking really great questions. I really enjoyed the time.
Awesome having you.